A university don has advocated free surgical treatment for GVG children as part of the government's responsibility to providing adequate medical attention to the underage. A professor of pediatric surgery in the University of Lagos, Professor Adesoji Ademuyiwa, made the call while delivering second inaugural lectures for the 2024-2025 academic session on the theme, Suffer Little Children to Come Unto Me, Surgeries and the Surgeon's Sojourn in Collaborative Research. Now, Professor Ademuyiwa pointed out that for children to have access to medical attention, surgery must be waived and made free, stating that children do not voluntarily come into the world with all sorts of ailments that require surgical treatment. He said the government should always stand in for the children by clearing their medical bills and providing them adequate health care for the future.
Certain characteristics that led to such conditions. For example, sepsis. We also discovered that reoperation and bleeding are things that led to death among children. And so we advocated that this should be prevented. Despite that, our studies show that even though we are not at par with high-income countries, like developed countries, nevertheless, our practice in Nigeria is still one of the best in Africa. We were able to show that. And then in the field of heart-stroke disease research, we were able to show that it is possible to perform primary surgery, primary pull-through surgery in young children, neonates, as well as in adults. And the one for adults is not very popular, but we've been able to show that it is possible. For children to have access, surgeries need to be waived. It should be free. Because children did not come to the world by themselves. If they have congenital anomaly, they have trauma, they have cancer, it's not their fault. So you can't expect them to pay for it. The government should pay for it because children are our future. So that's one recommendation we made.